Today, I want to talk about vitamin E. It's become oddly quiet, and that quietness is exactly why it belongs in this vitamin library. The fact that it is almost boringly quiet is what makes it interesting. Vitamin E didn't vanish because it was exposed or mocked. It faded because medicine gradually moved on and did so without drama. So here's the first question. Why was vitamin E taken seriously in the first place? Not by wellness culture, but by mainstream medicine. The reason was simple and genuine. At the time, oxidative stress looked like part of the machinery behind aging and chronic disease. Vitamin E is a fat-soluble antioxidant that sits in cell membranes. So the idea was that protecting membranes from oxidative damage might translate into fewer heart events, fewer cancers, and better long-term outcomes. It also fed directly into two very human motives: anti-aging and heart protection. If oxidation is aging, then an antioxidant vitamin sounds like prevention. This wasn't fringe story, it was reasonable, even exciting medicine. And that is why vitamin E received serious attention. That leads to the next question. If that idea was so serious, why did vitamin E fade? Why did it fade without controversy? The answer The answer is that vitamin E was properly studied. Large clinical trials were done and meaningful outcomes obtained. And they didn't show the benefits that people had hoped for. There was no convincing reduction in cardiovascular disease or cancer. And at higher doses, there were signals that made clinicians cautious, particularly around bleeding. The point here is not that vitamin E produced a single dramatic got you moment. The point is that large trials show no clear benefit, and there were credible caution flags that routine use becomes hard to justify. So, what did medicine do with those results? Not loudly, not defensively, and not with theatre. Guidelines stopped recommending routine vitamin E supplementation. Teaching moved on. Clinicians stopped discussing it as a preventive strategy. This is why many people don't remember a public reversal. They remember it as something that simply went quiet, or they just forgot about it. Now, here's the question I find genuinely interesting. In an internet age where almost every supplement gets recycled into new miracle, why didn't vitamin E come back? Why didn't it catch the imagination of popular media the way vitamin D, B12, magnesium, collagen, or other trends have? The answer is unintuitive. Vitamin E has an ending. It was tested seriously, it did not deliver a clear win, and it carries a real caution flag. The combination is difficult to market. It doesn't produce an obvious short term, oh, I feel good story. It doesn't fit the clean, deficiency narrative that most people like. And it requires a sentence that many people dislike hearing, especially in supplement culture: be careful. There's also a deeper lesson underneath the surface. Oxidation in the body is not just damage, it's also part of signaling and adaptation. So the simple idea that more oxidants automatically equals better health was never guaranteed to translate into better outcomes in real people. Vitamin E is one of the vitamins that quietly taught medicine that biological plausibility and possibility is not the same as clinical benefit. That caution flag needs to be said plainly because this video would be incomplete without it. High dose oral vitamin can increase bleeding risk. This matters most for older adults that bruise easily with thin skin, and for anyone taking other medication like aspirin, warfarin, or other anticoagulant or antiplatelet medications. It's also worth mentioning before surgery or procedures because people often don't realize supplements can have systemic effects. This isn't panic, and it doesn't mean vitamin E is inherently dangerous. It means it isn't a casual, just in case supplement for the heart health, or anti aging, especially when someone is already on medications that affect bleeding. At this point, another question often appears, especially in my clinic. If medicine moved on from vitamin E, why does it feel so familiar? The answer is legacy. Vitamin E did have a strong popular phase in skin health, especially decades ago. Vitamin E cream, vitamin E for scars, vitamin E for healing, and the ritual of puncturing a capsule and rubbing it onto the skin. Those ideas became deeply embedded, particularly among baby boomers. This happened long before social media existed. When something becomes part of a cultural memory like that, it can persist even after clinical practice changes. That's why older patients will mention vitamin E regularly, while younger patients rarely bring it up. So, where does vitamin E sit now in the skincare space, especially compared with other hype, newer vitamins like B3 or vitamin A? It hasn't vanished, but it's rarely the main actor. In modern products, it often appears as tocopherol, as a supportive ingredient sometimes used to stabilize formulations and sometimes paired with vitamin C in antioxidant combinations. Meanwhile, the spotlight has shifted to other vitamin cousins because they tend to have a clearer role in modern skincare. Vitamin A, photoaging, turnover of cell. Vitamin A is central to cell turnover and photoaging change. Vitamin B3 supports barrier function and inflammation. Vitamin C is discussed for collagen signaling and pigment support. Vitamin B5 is used for repair and tolerance. Vitamin D matters more as a systemic hormone-like signal, than as a simple skin cosmetic ingredient. And vitamin E remains in the background. It is no longer taking the lead in the conversation. And a small but important practical note: vitamin E is not universally soothing. In some people, it can irritate or trigger contact dermatitis. That's another quiet reason the assumption that it can't hurt isn't always true, even for topical use. So let's end with the final question and the reason this episode belongs in the vitamin series. What are we meant to take from vitamin E's story? Vitamin E didn't fade because it was foolish. It didn't disappear because it was dangerous. It faded because it was tested honestly. The results did not justify routine use and medicine moved on. That isn't a scandal. It's a lesson in medical humility. And it's exactly the kind of quiet, evidence based equilibrium this channel exists to provide. Thank you for listening.